There are currently 5 new locally acquired cases of coronavirus overnight since our last report, bringing the total number of individual cases since the start of this outbreak to 70. And that includes 1 recovered case. 3 of these, of the 5, are direct primary close contacts of existing cases. 1 case is the second child of the family of 4 linked to the North Melbourne outbreak, whose result was indeterminate yesterday, but has come through with repeat testing and has identified as a positive case. Another is a household contact of the first worker who tested positive at the Maidstone Arcare Centre, aged care centre, and that person has been isolating throughout their infectious period as a close contact of that case. The third is a previously identified primary close contact who works with a family member who tested positive from the first West Melbourne group, that is a colleague of one of the return travellers from New South Wales. There are further 2 cases, 2 at the moment unlinked cases from the same household, and I'll get Jerome and Brett to talk about that in a bit more detail. The focus of our efforts over the past day have been casting a wide net around particularly that West Melbourne, North Melbourne outbreak, and closely examining the incidence of casual transmission elsewhere across both the Whittlesea and Port Melbourne outbreaks. Public health teams have been working very closely investigating the potential origins of the emerging Delta variant, and the Chief Health Officer has been working closely with interstate colleagues as to seek to identify that, and we'll have more to say about that shortly. More broadly, yesterday was another big day in both testing and vaccinations, and I want to thank the hundreds of thousands of people who have come forward over the past few weeks to do the right thing about making sure that they've got tested in record numbers and give the contact tracing teams all the support they need to map and trace where this virus is moving around, and the many, many tens of thousands who have come forward, indeed hundreds of thousands, to get vaccinated as the ticket out of this pandemic. Yesterday we saw 36,362 people come forward to get tested, and we saw 24,263 people come forward to receive a vaccine from our state-run clinics. Remembering, of course, as I regularly point out, our fantastic GP network also has vaccines. Yes, they churn through them at a very fast rate in face of demand, but they continue to have the majority of supply in Victoria. And we're working very closely with the GP networks to seek to increase that amount. So my thanks do go forward to every person who has taken the steps to be tested, to be vaccinated. I want to particularly thank those private sector aged care workers and the residential disability workers who we've been working with the Commonwealth to make sure that we prioritise that group of workers who care for some of our most vulnerable community members and make sure that we help the Commonwealth lift their rates of vaccinations. Many of those workers have made the most of our 5-day vaccination blitz at state clinics, and where we've been providing them walk-up access to those clinics. I can advise that over 10,000 people in this group have been vaccinated to date during the blitz. The blitz was due to finish tomorrow, but this group are continuing to come out in such strong numbers that we will extend that blitz to include Monday for that group of workers. So can I take this opportunity to encourage all private sector, indeed all aged care workers and disability care workers to come forward, continue to come forward to make the best use of this priority access lane. Remembering, of course, that you can also seek a vaccine from your GP, where you will also be prioritised. I can further announce that from Wednesday, this coming Wednesday, the 9th of June, until Sunday, the 13th of June, we will prioritise our hard-working Ambulance Victoria staff as our next blitz focus, who will receive priority walk-up status at vaccination centres right across the state. We want to get to the point where this virus isn't winning, and we want to make sure that our community works with us to keep ahead of how this arrangement can apply, and how all Victorians progressively, as more stock and more supply becomes available, to do what we can to get vaccinated as soon as we can with the supply that's on hand. That is the off-ramp for this pandemic. We're on this trajectory at the moment, which we need to build vaccines for. We are progressively doing that, and I want to thank the Commonwealth for providing some more vaccines for our state-run clinics after we sought to request that the other day. That is how we get on top of this, by following the public health orders, getting tested as soon as we have the slightest symptoms, and getting vaccinated to give us that ticket out of this pandemic.